Hindi niyo na ba ako itatakwil bilang mamu?
Yun naman po,
Okay lang?
It's okay, Doc.
It's okay lang po, Doc.
Huwag niyo ako itakwil ha. Baka picturean niyo ako nakaano. Uy, naku, nagpicture pala tayo. Naka-sleeveless ako. Hindi ka aya-aya. Anyway. Hindi ko nalang ipopost yun. Baka sabihin nila nakaano. I think you have an idea already of the Alma Ata, the Astana Declaration, and the Universal Healthcare. And I was not able to finish all the submission. Yung nauna nag-submit, nabasa ko. However, the good Alma Ata and Astana Declaration is just a declaration. The difference with the Universal Healthcare, this is a law already that is passed, no, in the Philippines. So it is part of the Philippine healthcare system already. Whether we like it or not, it has to be practiced. But the problem right now, it's the PhilHealth who will be in charge of the financing. But where is PhilHealth now? Medyo, what do you think, Clint? Nagkakaproblema tayo sa PhilHealth? Dr. Capuan, Clint?
Yes.
Anong issue ba sa PhilHealth ngayon?
Regarding po sa yung nawawala, maraming
alam
nawala.
niyo ba kung
Billion.
ano ito?
I think it's 10
Pera po.
10.5 billion probably.
Yes, yun ay yung IRM. It is parang siya, para siyang paunang pera for COVID-19. Pero dun sa na daw yun, for every may 2% cut ang mga PhilHealth. So, if you have 10 billion, 2% of that's how much? Hindi natin kaya, no? 10 times 2, about 20 million. Billion, 100 million. Ewan ko, hindi ako makaano. Basta 2% of every binibigay sa PhilHealth. Kaya, corrupt leadership, use of power, perverse use of power is really something that I hope sa inyo magsisimula ang pagbabago. Makibaka ang first year College of Medicine, who will be the future mayor, PhilHealth director, hospital director, MHO, city health officer, etc., etc. So, and all because of a health system that has no system at all. Agree, disagree?
Agree.
Diba? Pero sana naman, huwag kayong mapagod sa gobyerno. Magkaroon kayo ng pag-asa dahil habang may buhay,
May noodles.
Pag-asa. Pag-asa.
Gusto ko pa naman mag-ramen. Okay. Let's start. Healthcare delivery system is the totality of all, number one, policies. Ang policies, that includes department order, that includes ordinances, resolutions, infrastructures, facilities, equipment. Ano ba to? Start but okay. And services that address the health needs, problems, and concerns of all people. All the health facilities are being maintained by public and private sectors. Preventive healthcare is a major concern of the government-owned health centers, while curative care is provided by government and private hospitals. But ang nangyayari, even with the universal healthcare, no, ang focus pa rin ng mga tao ay curative. That's why we are very adept to strengthen our advocacy on public health kasi halos lahat ng issue ay public health issues. So, sa Pilipinas, ito ay ganito na triangle, no? You start with the barangay health station, you have the RHO or the city health office, you have the private practitioners, pero pagdating sa district hospitals, which is the secondary care, the provincial and the city hospital, the regional medical centers, and the teaching and training hospital. So we have the primary care, secondary care, and tertiary care. But the problem is on the primary care, it is owned and managed by the local level. Si mayor at si barangay captain, no? Si RHU. Pagdating sa except city hospital, those with city hospitals that are highly urbanized or component city, it is under the care of the mayor. But provincial, emergency, and district hospital is under the governor. And the tertiary care is under the national. I would like to, what would be the problem, okay, of this healthcare system? Kenneth Lumagbas, Dr. Lumagbas, what is the challenge if the primary care level is under the mayor, the district hospital, the secondary care, and the provincial hospitals are under the governor, while the tertiary care, regional, and under DOH, the national agency? Ano ang challenge dito? Kenneth, you unmute yourself. Dr.
Hello.
Lumagbas.
Hello, Doc.
Yes.
Probably the challenge in each level is how the funding is
Okay.
distributed.
Okay, that's one. The funding,
Tapos,
the resources. What else?
um, pag-disperse kaya pa da siguro dokit mga magtatrabaho ito dida nga level.
Okay. What about, thank you, Dr. Lumagbas. Lani Coritana, Dr. Coritana, what seems to be the challenge if the primary level of care will be under the mayor, the provincial and the district hospitals will be under the governor, but the tertiary care is under the national?
Oh, okay. Hello, Doc. What I can see is that since there are different leaders or authorities, like they may have different priorities in terms of the healthcare. I guess they would have different focuses foci in terms of the health programs they would advocate or what they would want to focus and what the community needs.
The challenge is, okay lang kung magkasundo si mayor at saka si gobernur, paano kung hindi? The devolution of health services has so much impact on the delivery of healthcare system, the delivery of services, healthcare service delivery. Meaning that with the dynamics of the politics in the Philippines, social determinants for health, ang laki-laki ng problema ng Pilipinas. Dati, ito ikaw, centralized. Now, it is decentralized. Okay? So, it is now a decentralized healthcare system. So, is there an advantage and disadvantage if the healthcare system is centralized? Or what is the advantage if the healthcare system if the healthcare services is centralized, is it advantageous? Isa na lang DOH sa lahat? Or is it disadvantageous? What do you think? Dr. Judy, Dr. Kay?
Hino mo gintawag, Doc? Sorry.
Judy Ann. Ay, sorry.
Judy, hello po, Doc.
Yes, hi. Now, I can
For
hear
me,
you.
for me, Doc, it will be advantageous since there is only one person who, or the person who will decide for everything.
advantage. So ano ang challenge kung isa lang nag-ano, kung sa national pa manggagaling lahat ng utos? What would be the challenge there, Geraldine? Dr. Calvero, what would be the challenge kung galing pa lahat sa national? Kain lang ako chocolate.
Good evening, Doc.
Yeah, Dr. Calvero, yeah.
I think po the challenge is, first, mahihirapan po munang disseminate whatever the decisions are.
What else?
Hello? Yes, that's the first po. And second, just like what po Dr. Coritana said, what if po the priority is different in the secondary care or the primary care? So, and if the decision comes from tertiary care, hello? Okay.
Yeah, I can hear you.
Yes po.
Yeah, I can hear you.
Different decisions po. Then, what else? And I think po
Wala na?
if... Hello?
Sige, I can hear you.
Sorry, Doc. Mahina po kasi yung internet. I don't know if I'm being heard or what. Yeah, so
We can hear you.
yeah. And the if only one po is managing, I think suggestions is being limited.
Mhm. Actually, if you notice, social welfare, health, and agriculture are devolved. Ibig sabihin, decentralized. Education and police force are not decentralized. Bakit kaya? No? So, the very reason why we still have disparity sa mga health system natin is hindi pwedeng the Department of Health will just only give technical assistance. It is still the authority of the local chief executive at the secondary level and even in the primary care level. Sila magbubuot. Tama yun, ano? And the decision-making process now will be under the decision-making process now will be under the local chief executive. Okay lang sana kung ang perspective ng mayor pare-pareho sa perspective ng governor. You are correct with Ms. Cortana. And alam naman natin, hindi naman lahat ng mayor, hindi lahat ng governor inclined to health. So, that's why there are times na when it happens, dati nasa Department of Health ako, when we move to hospitals, grabe sa mga district hospital, ang dilim-dilim, yung mga cotton balls, para wala man lang betadine sa district hospital. Do you agree? Nag-a-agree ba kayo dyan? Na para talagang napabayaan kasi yung iba gusto nila infrastructure. Pero wala namang healthcare worker. So, these things, contributed why we still have problem with maternal mortality rate, problems with infant mortality rate. So, ibig sabihin, just like our own body, the result of our own body is a product of what we take in. Kung puro ka soft drinks, puro ka Netflix, puro ka, ano ba yan? Kung ano-ano ipapasok mo sa utak mo, sa isip mo, sa katawan mo, anong resulta?
Obesity.
Obese, hindi matatambok kang ka. But I'm not telling you medyo matambok, hindi ko pa nga kayo nakita sa personal. But ano ito, this is universal law. What gets in, gets out, or whatever you sow, you will reap. The same thing with a system. Kaya siya tinatawag na system. If the healthcare delivery system is not working at its best, there will be what? Disparity of health. There will be what they call this? The outcome, no? The outcome of our statistics, makikita mo, no? Katulad halimbawa ngayon, dumadami yung suicide. Kasi nakapokus lahat sa COVID-19. Dumadaming namamatay na hindi COVID. Why? Kasi ayaw na lang nilang pumunta sa hospital. Bago ka pa pumunta sa hospital, hala, kailangan may test ka. Tapos pag positive ka, nandun ka, suspect ka, sa mga private hospital, you know how much per day? 15,000 ang room per day or 20,000 sa isang hospital dito sa Tacloban. Kahit pa milyonaryo ka, you will not pay 20,000 per day, right? For a COVID-19 case. But that is what is happening. Kasi ang PPE mo, papalitan mo every day, every hour. Hindi pwedeng ulit-ulitin yung PPE. So, there are several factors that affect the healthcare delivery system. And one of this is the devolution of services. Okay? Health services. So, if we have a building blocks, 'di ba, nasa ano kayo ngayon, anatomy, physiology, yung ating body meron ding building blocks. The same with the health system. We have building blocks. Our building blocks, ito lang ang tatandaan nyo kasi lalabas lahat yan sa exam. 6 building blocks. Katulad ng ating body, may building blocks tayo. The first building block is service delivery. Wrong spelling ako. Forgive Mamuji, I'm sorry. Service delivery. Service delivery is what we give. Immunization program, basic curative services, family planning, maternal and child health, nutrition, and this. Health workforce talks about what do you call this? Doctors, nurses, midwife. Kailangan there will be one doctor for every 5,000. 5,000 ba yun? Population. Ilan ang doktor ng syudad? Tudo. No? 3 regular doctors. Okay? Next is information. Information, of course, ito yung katulad ngayon, ano na tayo, puro E na tayo. E-learning, everything is E, no? And then medical products, vaccines, and technology. Alam natin, these building blocks will affect the health system. Okay? Ito yung inputs natin lahat. Then, of course, financing, leadership, and governance. Okay? I'd like to ask, I'd like to ask Alvin. Did I call you already? Dr. Alvin James Baldwin. Ano?
Wala pa, Dok.
Sige. Among the 6 building blocks, saan malaki ang gap ng ating healthcare delivery system sa Pilipinas? Is it on the service delivery? Is it on the leadership? Is it on the workforce? Is it on the information, medical products, vaccines, and technology, or financing? And why?
Para ako, Dok, one of them is service delivery, Dok. Tapos health
Why?
workforce. Service delivery, Dok. We have areas in rural areas na waray RHU, kulang it mga era mga na-work dito, tapos it mga to rural area na pipiritan kapag kadiha syudad para makakuha lahin to ang healthcare na service. Tapos ang health workforce kay
That's true.
health workforce, Doc, is because for me, Doc, nagtrabaho manggap ako for 2 years, but
Yeah, okay lang.
it's
Sa NDP? As NDP?
ano, Doc,
Saan ka
private lang
na-assign?
private lang doc na
Okay.
clinic. Health workforce is dahil underpaid doc, hindi katumbas yung sweldo na nakukuha sa trabaho. Parang ganyan doc. So yung ibang health workers
Correct.
napipilitan mag-abroad to para
Mhm.
ayun, medyo masenso yung buhay doc. Ganun. That's all doc.
Yeah. Very good. Ano? Thank you, Alvin. Totoo yun, no? Yung sinabi niya. Bakit naman ako magtsatsaga ngayon? Meron na naman, bababa, talaki nga yung sweldo, bababa naman yung salary grade mo. So, something like, marami talagang nangyayari na nagkakaroon talaga ng mga gaps, no? And one of that, sabi ni Alvin, is service delivery and health workforce. I would like to ask another person, sino ba? Dr. Korea Aurel Nino.
Doc?
Among the six building blocks, alin sa palagay mo dyan yung top 2 mo na lang? Top 2 that we have gaps.
My personal opinion wise, I would say information and leadership and governance. In terms of information, most from experience, it's far too easy for misinformation to spread from chain messages in Messenger to Facebook posts. Misinformation is far easily spread than the right information that we learn and study in class and in medical practice. And in terms of leadership and governance, I guess it's visible to especially recently with the cases for with how the question as to how the government handled the start of COVID and recently the problems with PhilHealth.
Yeah. I miss you. Hello?
Doc?
I lost you. Yeah.
Uh,
Okay na. I can hear you now.
which part got lost, Doc?
COVID-19.
That was and when
You
I
said
talked
just like in COVID-19.
for leadership and governance, a gap is in terms of how from from most I think from personal perspective, how the start of COVID could have been handled better by our government and leadership, as well as the current issues with PhilHealth.
I lost you again.
Okay lang, Doc.
Ako bang may problema?
I'm not sure, Doc.
Anyway, baka ako. What you are trying to say now is we have gaps in leadership and governance, which I agree, and also in the information. With the so many information we are getting, we still have lack of access to true information, correct? And
Yes,
on
Doc.
leadership and governance, very, very crucial ito siya because it's not only on COVID-19. That's why we have now health leadership courses that is being given to the local chief executive. I remember when I was still with the Department of Health, nagrereklamo mga mayor sa mga MHOs kasi sinasabi nila mas malaki pa yung sweldo ng rural health physician sa mayor. So during that time, a rural health physician, hindi pa kasi devolve yun eh. Mas malaki ang sweldo ng national. So pinag-payback niya yung doktor. Kawawa naman. But ang sinasabi nitong building blocks is if you have access to service delivery, you have better coverage for your health workforce, you have the right information, and you are ensuring safety uh, of the and quality medical products and vaccines and technologies, and all you have better financial outcomes and leadership, it will result to the following: improve health level and equity. So meaning that dapat ang isang munisipyo, hindi na nila nire-refer yung nagda-diarrhea, kaya nang i-manage sa rural health level, even pneumonia. Second is responsiveness. When we say responsiveness, that in the demand for healthcare, hindi mo na sila pipilitin pabakuna. If a very good kung meron talagang magaling ang advocacy dyan, they will just respond. Nagpo-problema tayo ngayon sa immunization. Pag magproblema tayo sa immunization, magkakaroon ng outbreak. Diyan nagsisimula yung outbreak. For vaccine preventable diseases, we need to have the right target for our immunization. Hindi natin ay pa herd immunity, hindi natin will be available for measles, pneumonia, IM of the vaccines. Okay? And there be better access and coverage. Now we can have a social and financial risk protection. We want to protect the poorest of the poor. But what is happening? Saan napupunta yung binibigay natin galing sa ating mga taxes, sa ating mga pantawid pamilya? Once they receive their 4Ps, nasan sila nagpupunta? Instead na ang binibigay ng 4Ps are for health and education, saan dinadala? Ayun, nagtotong eats.
Bingo,
Tapos
bingo.
bibili agad. Ha?
Sabungan.
Bingo.
Oo, totoo yan. So, pero hindi
Lodging
nyo ba
house,
alam? Correct. Galing yan. Saan?
Lodging house.
Ba't lodging house?
Gumagawa ng bagong anak para may dagdag 4 piece.
Ay nako, nakakalungkot talaga. Oo. So, and then improve efficiency. So, that's the best thing that would ever happen to all of us and to all of you future public health officers, no? And lahat naman ng curative should have a public health component. Next is, nabanggit natin kanina yung primary, secondary, and tertiary level. At the population, if you are at tertiary level, it's highly specialized, di ba? So, the national and the regional hospital like EVRMC should cater to the tertiary and if there's a level of care. So, yung mga population nila yan, yung mga highly specialized lang, yung kailangan ng orthopedic, na hindi kaya, heart surgery, open heart surgery, doon yan dapat sa EVRMC. Pag sa secondary level, okay, you have the inpatient and diagnostic care, even including surgery, then you will have the regional population. At pag primary level, ambulatory and first entry level, ito yung preventive healthcare. So your population is the community. Your target population is the community. So the healthcare system is based at the barangay for the first level of healthcare that is integrated. So hindi dahil primary care ka, wala ka ng curative. You have the basic curative, but it's integrated, yung preventive and curative care. It has to be continuous and it has to be holistic. Okay? Lang kayo mag-bat in lang kayo if you have a question. Okay. Next is, health services can be classified according to preventive services for community groups at risk. For example, ano ang mga preventive services na ibibigay natin sa mga stroke patient? Ito, community-based rehab. Ano mga preventive services ang ibibigay natin sa mga nag-stroke? Ganun din, community-based rehab. So, meron kang specific preventive services sa community groups at risk. Sa mga bata, then you will give immunization. And then curative services for acute and chronic illnesses and hospital services. So the health system responds to the health problems or needs of the population, and it serves through the provision of health programs. So again, The level, primary level, it is a barangay health station or RHU, and the function and services is health education, control of locally endemic diseases, immunization, nutrition activities, treatment of common diseases, essential drug provision. That includes ito yung hindi na ngayon basta hindi na basta ngayon infectious diseases but emerging and re-emerging infectious diseases. So sa secondary level, RHU or CHO, again, we have health education, minor surgery, simple drug. Tertiary is specialized and complicated cases and health education. Question. Okay. Dr. Paul